As the pandemic continues, researchers are working to find a cure. Our national investigative team is in touch with a doctor looking into a particular drug that may hold a promise, a drug that experts in the White House
Two doctors in consultation with the Stanford and UAB Schools of Medicine, along with National Academy of Science researchers, published a study titled The Effective Treatment for Coronavirus. The report finds a drug called chloroquine is an effective antiviral therapeutic treatment against coronavirus disease. Dr. Gregory Regano, the project lead, told us by phone today he planned to spend at least 4 hours in clinical trials on this afternoon. By text, he told us we have a lot of work to do and need to hunker down. At an afternoon news conference, President Trump seemed encouraged about the possibility of getting this and several other drugs approved.
And I have to say, if chloroquine or hydroxychloroquine works, or any of the other things that they're looking at that are not quite as far out, but if they work, your numbers are going to come down very rapidly. So we'll see what happens, but there's a real chance that they might work. Go ahead, please, in the back.
The study by Regano says last month the UK banned the export of chloroquine. The study says it likely happened because of the growing body of evidence of the drug's effectiveness against coronavirus. Some type of treatment is something people who are getting sick or losing jobs are desperately hoping for.
Hopefully, this will all come to an end and they'll find a cure and everybody will get back up and running.
One health expert told us today he thinks the approval for this drug could come as soon as sometime next month.
We need to go through a process where we know that the drug is working. Once the drug is working, it's not going to stop the spread. What it will stop is deaths from severe disease, which will have an effect on what we are told to do, because we're not going to be quite so worried about cases filling up the ICUs and being unable to be sustained.
Currently, the drug chloroquine can be prescribed for the prevention or treatment of malaria. The report says it can be prescribed for adults and children of all ages.
The doctor who is working on this clinical trial plans to follow up with our team to let us know of any significant developments. Still ahead here at noon, the Mr. Food Test Kitchen has a chicken recipe that they say could be in a 5-star restaurant. Stick around.